The hearings into the National Health Insurance Bill, that's the NHI bill, are underway in the Northern Cape. During the last round in Mpumalanga, people used the platform to not only discuss the bill, but highlighting as well the challenges they face. The public is being urged to also make written submissions. Well, for more on what's happening in the Northern Cape, I'm joined now on the line by the Health Portfolio Committee chairperson in Parliament, that's Dr Sibongiseni Dhlomo, who's on the ground traveling in the Northern Cape. Dr. Dhlomo, very good morning to you, and thank you very much for giving us your time. When did the latest round of public hearings begin in the Northern Cape, and how are they going?
Good morning, Mr. Moyane, and good morning to all your ENCA viewers. We started this Northern Cape round on the 1st of November, which was a Friday, starting in Kimberley, where we met the people there in the Kimberley Town Hall. And the next day, we then drove to Da'ar, further down, and met also people. There was a bit of a challenge on the 2nd of November. As you probably might recall, it was the day where most of the South Africans focusing on the World Cup rugby, but nevertheless, people came in there. We started a bit late, or an hour later, but people also came in and made their inputs. Yesterday, we were in Uppington, and we drove after that. We're now going to be starting our afternoon hearings here in Springbok, and that will be the end of the rounds that we are doing in the Northern Cape, focusing on 4 towns in this province.
Okay, you're going to Springbok today. Hopefully people will turn up. It's an apt-named town after the Springbok's victory of the World Cup. But on the NHI bill itself, we saw during the Mpumalanga hearings the public making their inputs and asking all kinds of questions and raising challenges faced by the public healthcare system. So far in the Northern Cape, what is the approach of the public? How are they contributing to the discussions?
We are happy when you check the understanding of the people on the bill and what it actually aims to do, giving South Africans a universal health coverage, irrespective of whether you have money or no money, irrespective of whether this is a public or private hospital. Their understanding on that is quite, really commendable. However, people are raising challenges, and we are happy that the Department of Health, both nationally and provincially, are with us in these hearings, because some of them are saying, we would wish this NHI should take off immediately. Some of us who have been waiting for it for a long time. But what about these long queues, the shortage of staff, shortage of medicines, the poor quality and the poor attitude of staff here and there? When is this going to be attended to? Now, we don't answer those questions. We will call upon some of these provincial departments to give us an indication of what is their progress in terms of these issues that are being currently raised up. Our people also are not very quiet on saying we would love to see NHI taking off. We are concerned, however, about certain things that are happening in the country. Is this fund not going to be part of those where we have seen corruption and things that are actually affecting our government programs? How are we going to really make sure those things don't happen? And the Department of Health being with us, we hope that those messages will be carried on to the minister to make sure that those issues are addressed to the community, because as a portfolio committee, we're there to listen, the understanding and the comments of our people, document that, take that to Cape Town, countrywide, and be able to assess what is the issue. But some of these day-to-day issues about the shortage of staff here and there, the absence of medicines here, are things that must currently be outlined. Of course, we are aware that the bill touches on the Office of the Health Standard Compliance, which is actually compelling the minister to make sure that facilities in the country, especially the public, go up to a particular level of competency and in terms of compliance with the healthcare standard delivery in the country.
Okay, Dr. Dhlomo, very briefly before I let you go to prepare for today's public hearings this afternoon, for how long are you going to be in the Northern Cape? Is today the last day in the Northern Cape, and where to next?
Yes. This is our last day in the Northern Cape in Springbok, as I did mention, Kimberley, Da'ar, Uppington, and now Springbok. We will then, next week, members have not been able to, we appreciate the sacrifice the portfolio committee members are making. So next week we take a week off, and then the other Friday, the 15th, I think, we start in the Limpopo. Back to back, we then move the following weekend to KwaZulu-Natal, and Eastern Cape. Parliament rises around the 5th or 4th of December. We would have done those 3 other provinces. When the Parliament, next year, we will start much earlier than Parliament opens. We will start around the 20th of January with the inland province, Free State, Northwest, and Gauteng back to back. And we hope that by the first week of February, we'll be doing Western Cape, which then will take us into the State of the Nation address. Then thereafter deal with the written submissions, by the way, which we are still expecting from all South Africans up to the 29th of this month. They can still write their written submissions, and we are ready to receive them. We will then thereafter sit and look into all those, and hopefully the process will carry on in the House. I mean, looking into this right until May, June, and ready to hand it over to the Speaker for the debate in the House, and maybe finalizing the bill into law somewhere there.
Thank you very much, Dr. Dhlomo, for your time. Dr. Sibongiseni Dhlomo is, of course, the chairperson of the Parliamentary Health Portfolio Committee. They are up and about in the Northern Cape as they continue the public discussions around the NHI bill. Next,